Well, hello again, and we're continuing today with our look at antibiotics and antiviral medications, and we're going to talk about antibiotic resistance. So those of you doing biology have probably spoken a lot about antibiotic resistance already. This is something that we also need to look at from our chemistry perspective in terms of our option. So antibiotic resistance, as many of you would know, is a growing concern amongst our society. The use of antibiotics is resulting in antibiotic strains of bacteria which are causing infections and diseases which are very hard to treat. Okay, this arises when we get drug-resistant strains, so strains of bacteria that do not respond to our normal drug treatments. So the World Health Organization is listing antibiotic resistance as one of the most pressing global threats to human health, in that if we continue to have infections that are building resistance to our current drugs without the development of new drugs, we have no way to combat these. So penicillin, which is what we're largely looking at in terms of antibiotics, okay, resistance in penicillin is seen through the production of penicillinase, okay, this ASE telling us it's an enzyme, and basically it is an enzyme that has evolved in bacteria to specifically break down penicillin by breaking down the beta-lactam ring. So when we treat an infection with penicillin, the bacteria that contain this enzyme, penicillinase, okay, can break down the penicillin and therefore will not be affected by it. Because these strains then survive under standard treatment, they then survive to be able to reproduce, and that beneficial mutation is passed on to the next generation. So resistance arises as a result of overuse and misuse of antibiotics and antibacterials in our society. So taking them when you don't need to, not taking a course of antibiotics for long enough, the use of antibiotics in feedstock and things like that. So if we look at a simple schematic of how antibiotics resistance actually occurs, what we get is in any population of bacteria, there are a few bacteria that may have a natural resistance. You should remember this from year 10 evolution. Okay, so when we use antibiotics to kill the bacteria causing the illness, okay, we end up killing pretty much all of them except the ones that have the resistance, because these ones that have the resistance now are left to multiply. The drug-resistant bacteria take over, becoming the dominant type. It is also possible, for the way that bacteria replicate, for them to be able to pass the drug resistance on to other bacteria that they come into contact with, okay, using plasmid DNA. So there are a number of sources of antibiotics, or the life cycle of antibiotics within our society, okay? So anytime we use an antibiotic, we are potentially creating resistant bacteria. So in a lot of feed stocks, animals are fed antibiotics to basically help stop them from getting sick in order to maximize production. However, by doing that, we are increasing the chances of antibiotic resistant bacteria. So then some of those bacteria can remain in the meat or the food and be passed on. Or fertilizer that contains animal fecal matter, fertilizer, all that kind of stuff with runoff, then allows that to pass into our water system and our other crop growing systems. Anyone who has an infection that is treated with antibiotics, okay, is under threat of the same thing. So treating an infection with antibiotics, you can end up with some resistant bacteria. When you return to work or school, you can spread that bacterial infection, or by going to a healthcare provider. Okay, so essentially we have these mechanisms either through the use of antibiotics in our food production or the use of antibiotics in everyday life, where the nature of how rapidly bacteria reproduce and mutate in order to be able to come up with this, we find that they form antibacterial resistance quite quickly. Okay. So, the main issues relating to resistance or the development of resistance include patient compliance. Now, this is basically how well we follow instructions given by our doctor. So, if you don't complete the full course of antibiotics, it can prolong the disease and not all the bacteria are killed, giving them greater chance for mutation and uh, developing resistance, okay, because they live longer, they have more mutations, and then they can eventually produce bacteria with resistance. The other one is prescription of antibacterials. So because if you go to the doctor and you have a cold or maybe even a virus or anything like that, you may be prescribed antibiotics. So what we're doing is, rather than relying on our own immune system because we want to get back to work or school quite quickly, we are over reliant on antibiotics, and what these may be doing is actually just killing off the bacteria. It may not even be a bacterial infection, so we could be promoting antibacterial resistance that way as well. So the other one is the use of antibacterials in animal feedstock. Because a lot of animals are fed antibiotics, they are often done so when they don't have a disease, and we can end up with a large amount of antibiotics in our feed chain. Okay, so there is a lot of research being done into antibiotic resistance, and this information is likely to change over time. But these are the main concerns that we have at the moment in terms of developing antibiotic resistance. So you should be able to outline how antibiotic resistance is developed and the implications for this for treatment. And then after that, you've nailed this assessment point.